Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Today, a multidisciplinary approach to enhance supportive care for small cell lung cancer. This is the fourth and final episode in our series on small cell lung cancer. Enhanced supportive care aims to meet the full needs of patients to improve their quality of life. Today, we're speaking with three guests from the Atrium Health Levine Cancer Institute in Charlotte, North Carolina. They are Dr. Kathryn Mileham, Chief of Thoracic Medical Oncology, Susan Yaguda, a registered nurse and manager for Integrative Oncology, and Michele Szafranski, a registered dietitian. Thank you for joining us today. Dr. Mileham, we'll start with you. What is the goal of the enhanced care program at the Levine Cancer Institute?
One of the things that was really important to me as a thoracic medical oncologist was to ensure that patients and their care partners were provided excellent care, not just through cancer-specific therapies such as chemotherapy, immunotherapy, surgery, radiation, whatever that treatment intervention may be, but really to enhance the entire process. And we recognize that what we think may be best care may not be what they think they are missing. And so we started an initiative to really identify what some of those missing components may be. What do people most want? And so we tried to ensure that we were aligning our goals with their goals. And we learned that there were many needs through patients and care providers that may not have been addressed previously. We know transportation is such a challenge and issue, but we also learned for lung cancer specific patients, breathing is a real need. It's the lack of breathing, the shortness of breath, the breathing difficulties with exertion that people most fear and want to improve upon. And so that became a real focus for us. How can we improve that for our lung cancer patients?
Ms. Yaguda, how are patients informed about these supportive care opportunities?
So when patients come first to Levine Cancer Institute, they are given a patient notebook, and this has it's a binder, so it's a physical notebook, and it has all sorts of resources in there, information, who to call for what, and it has information about supportive oncology as well in there. And then again, there's the providers are often the people that connect their patients with supportive care. The navigators are people that connect their patients with supportive care too. But then I would say that everybody on the supportive oncology team also can identify potential other needs that a patient may have. And maybe, we see somebody in palliative medicine, but recognize that they really could benefit from seeing one of the counselors, for example. And so we cross refer a lot and within just our department as well.
Ms. Szafranski, what does community collaboration look like for your team?
Well, in this initiative, we really looked for community partners that were well vetted. Patients had already had really strong relationships with some of the lung cancer programs here in town. And so we tried to really partner with them, also get their input about what they thought that patients needed, what was missing from our offerings that patients could benefit from. And so we really looked to those trusted care partners who have been doing this job for a really long time to kind of give us the feedback and buy-in that we needed to really push some of these programs forward.
Dr. Mileham, who makes up the multidisciplinary team focused on supportive care needs?
Our team is big, and we feel like that still there are no limits to how we can add to that. It's not just about the core physician team. When we think about lung cancer, that may include a thoracic surgeon, a radiation oncologist, a medical oncologist like myself, but it's also going to include all of the supportive needs, social work, patient navigators, the palliative medicine team, the physical therapist, the occupational therapist. I mean, the list goes on. And I think what's important is that there are no limits and that we continue to not feel satisfied with what we've already accomplished, but to build a program that can continue to expand based on feedback from patients and their care providers, and not be afraid to hear that feedback so that we can continue to meet their needs.
Ms. Szafranski, how do you maintain team engagement in building innovative services for patients?
Well, I will tell you that is the one thing I love the best about Levine Cancer Institute. As long as I've worked here, it's always been yeah, we can try that. There's never a bad idea. There's never a bad answer. If we try something and it doesn't work, we just scratch it and go back to the drawing board. But what I love about LCI is that you can come to the table with an interesting idea or, a connection that you've made in the community, and we can try to find a way to make it work. I think that keeps the team really engaged, and it also constantly brings new and exciting programs in for the patients.
Ms. Yaguda, can you tell me about a specific program you've seen that has impacted patients?
Sure. So Kazoo Blues was designed and developed by one of our music therapists, Dean Quick, and he created a series of training videos that showed patients how to use a kazoo as a way to strengthen their breath. And so we really wanted to put this into the hands of our patients as a way to not only give them something that was clinically beneficial, but also in a way that had a fun factor to it. And so our patients would get a Kazoo Blues kit. It came with a kazoo. Comes with like instructions of how to keep the kazoo clean. And then also had a QR code that they could click and access the training videos that Dean created. And so through a series of exercises using the kazoo, creating music with the kazoos, patients were able to start to strengthen their breath work. And it was, again, just a more fun way to do that rather than like an incentive spirometer or other kind of breath training programs. We had several patients that would do Kazoo Blues with, for example, their grandchildren, and they shared with us how much fun that was to have something to do with their family members that wasn't specifically cancer care related, but was in a different way. And so they could create music together, and everybody just really enjoyed it, but it was also clinically beneficial for the patient.
Dr. Mileham, what does the future look like for this supportive care program?
For us, I always think that the future is big. I'm never satisfied and always looking forward. I think it's a process in which we continue to reevaluate what we've already done. We look to other tumor types to see maybe some new and creative ideas that they are integrating into their own team. We are also trying to set the stage for others to ensure that what we've created specifically in the lung cancer program can be duplicated or built upon in other tumor types. So we feel like it's scalable. We feel like that it is something that we can share with others, because really our goal continues to be to provide that excellent care and support not just the patient, but also the care providers that are involved in that cancer care journey. I think that also the utilization of technology has expanded our options. And I think through COVID, we've learned how to integrate technology in a better way to address these needs and communicate with patients and family members all over the nation. We understand that people have limited resources, and maybe technology is not familiar or is uncomfortable and even still not accessible. So one of the things we've done for those people who are less comfortable or have less access to the technology and the platforms that we've created is that we bring that to them. We can bring that to them in a separate and comfortable lounge space within our clinic, we can also better maximize their time when they are in the infusion room, and bring them those resources on a laptop so that they can learn, watch, listen, and educate during that time.
Thank you for joining the show, Dr. Mileham, Susan Yaguda, and Michele Szafranski. You can head to the show notes for more information on enhanced supportive care methods and links to the related episodes in this series on small cell lung cancer. If you've enjoyed what you've heard today, go ahead and follow the Cancer Buzz channel for more fresh perspectives on the latest news and trends in cancer care. Until next time, for the entire Cancer Buzz team, this is Summer Johnson.